Good afternoon. Welcome to our webinar today. My name is Lydia Lofton and I work with the London Transformation and Learning Collaborative at Health Education England. And we're here today to provide the second in a series of webinars to give you an update on progress with the Respiratory Surge in Children programme. We're really grateful to all of you that have been able to join, and it's really exciting to see so many more people joining, and I'm sure that there will be others that will join as we get started. You'll see the agenda here, which we hope provide you a really useful overview of some developments in the programme since we last met with some of you in August for the first webinar. So I'll hand to Julie Coombs to provide a programme overview. Julie's our programme lead for the London Transformation and Learning Collaborative, and I'll hand over now.
Thank you very much, Lydia, and it's great to see so many people on this webinar today. So just to give you a little bit of a sort of picture of where we started and why we started, many of you will know that back in the summer there was data that was coming from the Southern Hemisphere that suggested there was a rise in children that were presenting with RSV and respiratory illness. That was looked at and some modelling was done within the UK to really understand what the implications might be for us and therefore for the health service. Over the summer, you can see through this data, and this data is from the 10th of November, so it's pretty up to date, that we saw an initial spike in the northwest of England, London, and the York and Humberside. Those initial spikes have fallen back down, but there is still significant activity, and that activity is unseasonal. So it's early in the season. We're used to seeing this type of activity more into the sort of winter and sort of January, February months. So fairly unusual. This really does have an impact on our services, and it has an impact on our workforce. And so there was a real concern that the demand was going to outstretch the capacity of the workforce. So there's a lot of work that was done during the summer to plan for this, and this is really where this programme came about. So we go on to the next slide, you can really see some of the aims and objectives. So NHSEI and HEE, as a collaboration with the Paediatric Intensive Care Society, were asked to look at how we could support the workforce, how we could look at the ways that training could be utilised to ensure that people felt safe to practice, and that people could be cross-skilled to look after children if there was a requirement, even though their background may not have been from within that professional area. In terms of these aims and objectives, we'll go into a little bit more detail of what and how we actually achieve that later in the programme. But some of the governance and the interfaces, you can see it has really been about a collaboration. Working together, and as much as you can see these are the bodies that you recognise, we also see that collaboration with yourselves, so with staff, with educators, with the sort of divisional and leadership within the different organisations, from primary care, community, and into our acute and tertiary trusts as well. So it has been a true collaboration, and learning from you to build this programme has really been key. In regards to some of the things that we have achieved, and I say we have achieved, is because of working with you, is that this site has actually been accessed across the country on reaching sort of 30,000 times. Resources have been accessed, again, you can see 44,000 times. So this is a resource and a site that is being utilised by our colleagues in practice, by yourselves, and we want to ensure that this resource continues to be relevant and something that actually meets the needs that you have in practice. The next slide just shows you a bit of an outline of the different areas in which people are accessing. So it is truly a national programme. So as much as we say with the London Transformation Learning Collaborative, we really want to work across the geographical boundaries and ensure that this can be accessed by colleagues no matter where they sit within the four nations. So I'm going to hand over now to my colleague, Libby Thomas, who is our lead for the education team, and can give a little bit more of detail around what has been happening and the educational resources that have been created. Thank you, Libby.
Welcome, everybody. It's so great to see so many people here representing all of the professions that we're trying to represent as well, which is really fantastic. We've got everybody from community through to tertiary centres and PICUs, which is just fabulous. So I'm just going to walk you through a little bit about what we've been doing, what we've got on the programme for those of you who are less familiar with it, and just to remind those of you who have accessed it before what is on there and in there. So what we're really trying to do is make sure we're covering the full broad spectrum of people who will come into contact with these children in the respiratory surge. So we're going from the primary and the community care, working with the Institute of Health Visitors, all the way through, as I said, to the tertiary care and the PICUs. And what we want to do is enable staff to be mobile, to move within the paediatric workforce so that they can support where the need is most required. And we want to make sure that people have the knowledge rapidly to hand and they can get to it really quickly should that need arise. Or if they're worried that things seem to be ramping up in their area, then they've got the content there that's rapidly accessible for them, and it's in short, sharp versions that they can get hold of. So we are targeting all these different care groups and levels, and we're also targeting the different staff. So we're targeting a lot about nursing, the AHPs, the physios, the pharmacists, speech and language therapists. We're looking at the medical staff, we're looking at educators and how we can support them with content for that. And also the support staff are important to us. So people who work with children in a non-professional way, but actually, as we know, are so key to providing care on a day-to-day basis. We divided the site up into different domains so that people can think about what it is they need to know and how they're going to approach their learning, and then hopefully they can find those resources more easily. So we have a bit that's about recognition, management and escalation of the child with a respiratory disease. And obviously that's really key to know what it is you're dealing with and how you're going to access that. We've got specifics about the respiratory illness versus just the sick child. We've got quite a lot of information on high flow, high velocity oxygen therapy, because we recognise that that's really key in treating bronchiolitis and other respiratory illnesses. And it's something that people may feel less familiar with. We've got a section on medicines management, and we're building this up with our pharmacy colleagues in order to make sure we have resources that are specific for pharmacists who may be asked to support children's services where they don't normally. And we also have an area within that about differences between adults and children. We look at family-centred care. We look at the stabilisation and transfer of patients, which may be really key as we need to mobilise and move patients around the country depending as the demand moves and changes, because as we saw from Julie's figures, there was a real peak in the northwest, and so actually can we offload and support by the surrounding regions, and that's really key to them moving forwards. We have a few resources on staff wellbeing. This is really key. It's something we know that it's been huge over the last sort of 18 months, and there's a lot of resources out there. So we're just trying to provide a few pointers and a few helpful things that might be more specific. And then you'll hear later in today's presentation about our new educator resources area and how we're trying to support those educators, stop them having to reinvent the wheel or spend their evenings writing new presentations, but actually they can access competency documents and things that we have already so that they can offload themselves and have more time to concentrate on their teaching and the staff they're working with. The resources that we have cover a large amount of different styles because we're trying to cater to different people's learning needs and the amount of time that they have in order to access those. So we have a category called At a Glance, which means it's less than 5 minutes. You can do it when you know you're about to go and see this patient, you're on your way home from work, you're having a coffee break, if those exist in your trust, or whatever else it might be. So you have that opportunity to just give yourself a little bit of revision or get up to speed, or you can hand it to one of your colleagues and say, well, have a look at this, and you'll understand a bit more about what I'm doing here. We have bite-sized learning, which is slightly longer, and it's between 5 and 30 minutes. And then we have some links to some longer packages or to some webinars, which take more than 30 minutes. But the idea is then you can plan your time and decide what you have the time to deal with and how much information you can take on at that point and then access it in that way. The resources vary. So we have webinars and we have some from Royal College of Paediatrics and Child Health. We have them from PIC Society. We have them from ourselves, from some of the transfer organisations. We have videos. Some of these videos are really short and sharp, 2 minutes, showing a bronchiolitic child. And some of them are longer, showing a simulation on how physiotherapists would approach a patient in this situation, or what you might expect to come across in the community. We have links to web pages, websites, and web blogs, and we're not trying to claim this work as our own. We're just trying to give you that opportunity in which to access the information from one spot, so you can think, oh, what else is there about this that I can find? And things like we link to places like Healthier Together, which is an amazing website developed by the people in the south of England, with loads of resources for parents, loads of really great resources for the community, really good algorithms, and we just want to highlight that that content is there and you can access it. There are some e-learning packages for those who like learning in that way. And then we have downloadable documents, which may be PDFs, they may be PowerPoints, they may be infographics, and don't forget the bubbles, which give you that one-page reminder and that really quick. And what we're trying to do is also build a repository of podcasts for those who like to listen to them. And if you have any great podcast suggestions, we would love you to share them with us today. We're striving to improve our accessibility to all our documents. We can't guarantee this on things that we're sharing that belong to other people, because with over 300 resources, there's clearly a lot of work here that needs to be done, but certainly the things that we're self-producing, we are aiming and striving to do that, and that's really key to us. And part of that is making sure we've built a skills matrix. We're trying to map all of our content to the skills matrix, which allows us to see where we're missing content, where things don't exist, and actually there's a gap that needs filling. And then we're making new content to try and fill this. We're trying to develop documents, things like simple calculations for people going to working with children who aren't used to it. How do they get around the idea of how to do those calculations, how to be as safe as possible in their workplace? Because we know by improving education and people's understanding, then we can improve the patient safety. It's really important to us that everything we do is evidence-based, and it's informed by the care standards and competency frameworks that exist already. That's why we're working closely with a PIC society. We're making sure we're referencing national guidance. And we have an overarching resources section on the website as well, which links you to the national guidance, to the NICE guidance, RCPCH, to PICS, so people can access those and get towards those from one place as well. We're working and co-developing collaboratively with the system, so we're making sure that what we have is user-friendly and it's helpful to you. And we have a large clinical education reference group who are really key and important to this, because they look at the content we've put up, they look at our ideas, they give us feedback, help us improve it. So that by the time that we get back into sharing it with you live on the program page and on the eLearning for Healthcare Hub, then you know that it's decent quality content. However, if you think something on there is incorrect, things do change. The more content we have, the harder it is to keep on top of it all. There's a feedback mechanism through eLearning for Healthcare, so you can tell us if there's a problem, if you've got a better resource that we can replace it with. And this allows us to be really user-led, refining and constantly evolving the program. The patterns change over the next few months. If we see different things evolving, if we see any novel diseases, then we've got the opportunity to respond in that way. And so this gives us a real sort of flow of what's going on and the way we use information. We do regularly update what's on the hub, and we have a real, every 2 to 3 weeks, we're putting new content up there. We're changing the program to reflect this. We're trying to use social media through Twitter and LinkedIn to also share those updates. So we're using the hashtag RespSurge. We're also tweeting under the HEE-TEL and HEE, so we can share those links and you know who to follow in order to see what the latest updates are and what's happening within those areas. And this allows us to also share where we're actually targeting certain groups in different months. So we've got lots of lovely webinars that have gone up from physiotherapy about managing these patients, and actually we're now developing our pharmacy resources next. And we're working our way through in that manner. Finally, from me, I just want to say that your feedback is so important to us and from all the users. And so we've developed an evaluation form that is going to be accessible through the program page and through the eLearning for Healthcare Hub. If you've already been onto our page before, I'd love you to grab your phones now, scan this QR code, and it'll take you to this really short survey that you can fill out on your phone here and now and give us your feedback, because this is the only way we can improve. We are a learning cycle. We're constantly trying to get better at what we do, and we can only do that if we hear from everybody here. And I am now going to hand over to my wonderful education team, and they are going to share with you some of the exciting updates that we have coming through and that are available on the website. So first of all, I'm going to hand over to Francesca, who is our nurse educator in the education team. Thank you, Francesca.
Thank you, Libby. So one of the things that we've been having a look at, and one aspect that we were trying to have a think about improving for everybody who's accessing the hub, was navigating the resources. We were aware that, as you'll see, over 300 resources have been uploaded. So where would you even start? It may be a little bit overwhelming and difficult to know where to start with your search. So as a team, we have put together some what we're calling rapid access lists to support your your start of your journey looking at the resources on the hub. So we've generated these lists. And you'll see they're the ones we've already developed for adult nurses moving to support children in different areas. High flow, as Libby said, is a high volume activity, and we've developed some resources to support. If you're just getting going with high flow, what would I need to look at? Which are the top resources that are going to support me in looking after a patient on high flow? We've had initial focus on these high volume areas, and we will be developing further lists to support with new education and new resources that have been added, and to support the wider multidisciplinary team also. So what do the lists do? Well, they offer you a quick start option with recommended resources divided into, if you like, a fundamentals section and then an extension section. So something to get you going, and then something that you might come back to support a deeper understanding or a deeper knowledge about the topic. And as you'll see, that we will develop these further. So if you do have any ideas for either a kind of a genre that needs to be added, or a topic, or some workforce that needs to be supported with a rapid access list, then please do let us know via the feedback function. And if you have resources again that you want to add, then we'd love to see them. So please do send them in, and we will consider adding them to our rapid access resources list. But do please let us know how you're getting on with them.
So you have to put tone number.
I will hand over to my physio colleague, Laura Lowndes. So she works with me on the education team, and she's going to talk about the next intervention that we've come up with.
Hi there, yes, I'm Laura. We have been developing over the last few sort of weeks and sort of last couple of months around different aspects for the resources list, sort of resources on the programme. So we've been focusing on different aspects of the programme. So we've been looking at sort of pharmacy and physiotherapy, sort of specific resources. We're putting them into very specific places. So for example, the pharmacy will be put under the medicine management, the physio will be put into the care and management of the child with respiratory illness. For some of the things we've been putting on, the pharmacy, we've got a couple of webinars that have been put on, and the same with the physiotherapy resource. So in the resources, there's a series of 6 webinars that have been put up on there. With the physiotherapy, we're also developing some sim scenarios that people can watch and go through to help develop their knowledge around PICU, treatment of children on PICU. From the speech language therapy point of view, we are producing some programs, some presentations around the impact of respiratory illness on swallow function, how to introduce swallow after illness, and that kind of thing. The other section we're also focused on in the last few weeks is introducing the parent and carer information leaflets. So, for example, so that you could be able to print off the leaflets and give them out to parents that you're seeing, whether it's in the community or on the hospital wards. We are looking to develop lots more resources in the next few sort of weeks and months, so do keep looking up on the site. There will be new things coming up often. And if anyone has anything that they feel would be good on here that's already developed, do let us know and put it on. You can email us via our email contact. So I will now pass you on to Jenny, who's also one of the nurses on the programme who works sort of more at GGH level. So Jenny, I will pass over to you.
Good afternoon, everyone. So as Laura said, I'm Jenny. So when we were looking through the submitted resources, we were coming up with a number of resources that fit into an educator section. So they didn't quite fit into any of the other domains on the website, and because they need some input from an education perspective, whether that's an educator or a uni tutor or whatever. So we decided to create an educator section within the website, and within that we've got some competency documents, and we've got a cross-skilling document that we've put together. It's sort of a compilation of lots of different things that have come from different areas. In that document, the cross-skilling document, there's a NG tube, some training, there's suction training, sort of a bit about general bronchiolitis, some meds management stuff. So that's a really great document on there. We've got some tracheostomy competencies, and we've got some clinical guidelines from other trusts. So as an educator, I know how valuable these resources can be when you're looking for something that you might not have, or you want to improve on something that you've got. We're hoping to add some simulations onto there. If there's anything that anybody thinks they would really like to see in there, just put a note in the chat. If anybody has got any resources they would like to share with us, then the email address is on there, the ltlc@he.nhs.uk. And a massive thank you to everyone who has already shared resources with us. So I'll now hand over to Tim, who is our digital content creator extraordinaire, and he will let you know about the skills matrix that we've been working on.
Hi everyone, so I'm Tim. So this is just to give a bit of an overview of what we're working towards for making some of the content easier to find. So as has already been discussed, we've got a huge amount of content on here with quite a lot of complexity in terms of which staff groups they can be targeted at, in terms of the care settings that it's talking about, and also in terms of the sort of format of that content, in terms of how long it takes to do and so on. And a lot of the feedback that we've had has been around that it can be quite difficult to find what you're looking for on there, even within the domains, because each domain could end up with dozens, if not hundreds, of resources. So something that we have been working on is building a new front end to make it easier to filter and find the information. Initially, this has started with quite an extensive piece of work of going through the existing content and categorizing it in as many different ways as we can find. So in terms of assigning relevance to certain staff roles, to certain care settings, and tying it into our existing skills matrix, which is a list of learning objectives. And so what we're building now is, there's a concept of it on the slide here, of hopefully a much more easy to use front end with multiple ways of filtering that content. So you'd be able to search based on what your current role is, search by which learning objectives you need to achieve, and so on. And also filter based on what kind of content you're interested in. So hopefully fitting to things like different learning styles, fitting to things like how much time you have to work on it. So this is in progress. It's not live now. We're aiming to have this ready to go, I think, sometime in the next couple of weeks. And what we're hoping is that this will really make it easier to get into the program and find what you're looking for as quickly as possible. So that's about that. So I'm going to hand back to Lydia.
Thank you so much, everyone. I'm just going to hand back actually to Libby. I think there were a couple of things that she was going to add around education before we move into the moderated Q&A.
Thank you. I just wanted to say that, you know, this is a really collaborative effort, and what's really key to us and sits at the heart of this team is that it's interprofessional, and we're encouraging all the professions and all the different care levels to come and use one central source for their information, so that they all understand what each other have to do as well. So while there might be some specific resources in there and things that are targeted more towards one group than the other, actually everybody can access everything, and therefore they can see how they can support their colleagues. How can you support those people who are slightly overrun in the middle of the night by helping them out with their workload and understanding what's expected of them? I think the other thing which we haven't necessarily stressed, that this is all hosted through the eLearning for Healthcare Hub, which means it's free, it's open access to anybody across the 4 nations of the UK. All that needs to be done is an initial registration with eLearning for Healthcare, and then after that they get full access. It is frustrating because it times out after 15 minutes of inactivity. So you just need to be aware of that and remind people. But everything is formatted to be able to be accessed on phones, on iPads, on internet, and it can also be accessed on the wrong side of the trust firewall, which is fantastic. So they've got that access wherever they may be and encouraged to do that. E-learning for healthcare keeps a record of people's education and what they've accessed and touched on, so people can use it for their CPD as well, for sharing with their managers if they need to, and showing how their learning is progressing. So there's lots of benefits for using it through this system. It may make it a little clunky at times, but there's so many benefits that outweigh those elements that we really hope that you make the most out of it. But as we said, we'd love your feedback. We're an interprofessional team. We're always looking for more ideas, to give us a shout and let us know. And I'll hand back to Lydia.
Great, thank you so much, and thanks to everyone in the team for all your hard work, for presenting all of these developments today. I think just really, another key point is that we really want to make it very clear that this is for all of you and for your colleagues, and we hope that it's meeting your needs. So we do really ask that you provide feedback, that you give us ideas, and we'll do our best to be as responsive as we possibly can, and as quick as we possibly can. And so the developments that the team have been working on to make these rapid access resource lists live, and also the skills matrix more accessible and more interactive, are really big pieces of work that we're really excited about, and about you being able to use, because we think it will make it even better to access the content. So we don't have loads of questions, but I've seen a couple come up. So I'll just address one that I know I have seen, which is about asking when the rapid access resource list will be live. I'm just going to hand that over to, I think, Tim. I think I know in my mind when it is, but I don't want to say the wrong day of the week. Tim, can you just give us an update on when those will be ready to use?
Yeah, absolutely. So we were waiting for some content uploads, which I've actually just had confirmation during this webinar that they've gone live. So the next step that we'll be doing is just submitting those access lists to ELFH to upload. We would expect that would then be done within the next week.
Great. So we are pushing to get those live as soon as possible. So do start using the site and check back. It will be a week maximum, and it's possible that it could be sooner than that. So we do look forward to having those live for you to use. I'm looking forward to trying them out myself. I've seen another comment in the chat about where you register to access the training, and thanks, Rebecca, for commenting on that. Just to highlight to everyone, you go to the eLearning for Health website, and the direct link to the Respiratory Surge in Children program page will take you straight to what you need to do. And then when you go to actually access the content, there will flag up a registration process for eLearning for Health. Anyone can register. You don't have to have an NHSnet email address. Anyone from across the 4 countries, the 4 nations, is able to register for free. So please do that. So another suggestion that I've seen in the Slido was actually about some areas of content that we might be able to develop further. Just thinking about some other places that might benefit would be around for nurses who are child field nursing students who may be out in practice during the surge, or for those who might be returning to practice, as this could happen, as it was the case with COVID. So we'll definitely make note of those suggestions. They're really helpful ones. I can also see, this is a question about, is there anything about COVID or RSV ventilation strategies in the resources? Now, off the top of my head, I'm not going to be able to answer that effectively. I think I'll hand that over to Libby.
So we haven't got anything specifically about COVID on there, because our remit is very much around the RSV and the respiratory surge, in terms of pneumonias and other disease processes. So we were told to stay away from the COVID element of it. The second half of that question, though, is about RSV supportive strategies. Is that right, Lydia? I think so.
Ventilation strategies for either COVID or RSV.
Yeah, so there's definitely stuff there that's designed towards the sort of the tertiary care end, and ventilation strategies to a degree, preparing people for transfer and stabilization, about different types of oxygen therapies to support, and ventilation as well. The other thing that we do have, which we can put the link in, is for our, or it's on the program page, we can put the link here too, is our equipment matrix, which actually links people to all the different types of equipment you might come across, which includes things from the adult era, because we developed this when we were doing an adult critical care COVID program, so it has a link to all the different ventilators as well as different high flow devices and things like suction pumps and any other sort of electronic device that you might want to use with a patient when you're stuck in the middle of the night and going, I can't get this button to go off, or why is this not working? Then it'll give you a quick access to the resource guide or to a video and how to use it and help support people from that end. If I can respond to another question I saw in the chat, Lydia, somebody was asking, was like, how long does the e-learning take? Well, the idea is this is not e-learning as you know it. We're not prescribing a course of e-learning that you have to do. If you were to go through all of the resources, it would take an exceedingly long time. What we have done is provided these sort of rapid access lists, which will give people a quick introduction to key resources in different areas, which are designed to take between 1 and 2 hours if you did everything on that list. The other idea is that you can self-direct and you can choose what it is you want to do and how you want to learn. If you're an educator who asked that question, then actually you could go and make your own shortlist and say, these are the things I want my students, or I want my trainees, or I want my band 5s to learn and be up to date with, and you could make your own e-learning package from it. And if you have questions about that, then we're more than happy to, well, answer them if you contact us on the LTLC email address. So it's not just a one package for one person, but when the skills matrix, searchable skills matrix is up and running, then you'll be able to look at the different resources very, very clearly that specifically meet your learning need.
Great, thank you so much, Libby. The other question that I've seen is specifically about COVID in acute care pediatrics, and I think Libby has mainly addressed that in the previous question, that our remit is quite specifically focused on RSV and other respiratory illnesses. However, if pressure becomes higher with children in hospital with COVID, then that remit could change. But at present, there is not focus in the resources on COVID. So what's the best way to stay up to date with the latest program updates? This is a really good question, and we are doing our best to get those updates out to people. But I think hearing from those here in the chat on how you receive information is really beneficial for us. I'll just hand that over to Libby again about the updates that we provide on the weekly or bi-weekly basis.
So on the program page, we have a section that actually shows what the most recent updates are and what we've added in from that perspective. We do also try and sort of tweet out. We don't have a mailing list per se that we send out telling people, you know, what the update is this week or that week, because of GDPR and hosting all of that data at a back end, which is one of the challenges. But we'll get my team to just link. Tanya, could you just put in the HEE tag so that people know who they should be following on Twitter if they want to get this information, or who to follow on LinkedIn as well. Otherwise, please just check out, come back every couple of weeks, see what's new, see what's changed, and it's a fun way to start exploring.
Another thing to highlight is that shortly we are going to have a new icon to use on our social media posts through HEE that actually says new resources launched or new resources live. So you can watch out for that as well, and they'll all be hashtagged with RESP Surge. We do have a question. Oh, Jenny, I'll let you add to that.
Sorry, I've just seen that Julie's popped in the chat the link to the equipment matrix. So I just wanted to reiterate to people how great of a resource that is. So it was started during when you were working on the adult COVID programme, and then has since been added to on the PEDS programme. And Tim has been working on the new interface for it, so you'll be able to save it almost like an app on your phone, and it will work as an app on your phone. And it's got most, if not all, of sort of the equipment that you might see in various different hospitals. So I just wanted to highlight that. Thanks, Julie.
Great, thanks, Jenny. Tim?
Just to very quickly temper expectations, that particular update is not live yet. It will be by the end of this week. So if you're having a look at it today, it doesn't currently have the web app functionality that Jenny was just talking about, but by the end of this week it will, and we'll probably try and publicise something about that when it happens.
Great, thanks, Tim. Another question that we've had come through is whether the rapid access resource list will come soon for GP care, for general practice care. So I will I believe it was Ginny that presented on the rapid access list. Ginny, would you be able to provide an update on the ones that are going to be going live and then the ones that are in development?
So the ones that we've got in develop currently are sort of a general basic RSV for sort of anyone working in a healthcare setting that will cover all of the basics. We've got one for adult nurses working on the peds ward. I think that one's already live actually. We've got peds ward nurses moving into level 2 care and level 3 care. Those are the 3 that we're focusing on at the minute. And then we've got some more AHP ones going up. So we'll have the pharmacy, and I think, is the physio one already up or going live today?
I'm just looking at the
Going
slide that was
that's going live.
Yeah.
And I'm just wondering if it might be helpful actually to put the slide back up that Francesca presented that had the different developed lists. So this is the rapid access list. So the ones that are developed and that will be going live shortly in the next week are in the top box. And then you'll see the proposed future lists that are in development, and a GP refresher is one of those, just to answer that question. And I think at this point, what I will do is draw us to a close, because everyone's time is so valuable, and we're really thankful. We've had more than 200 people here today, which we're really thankful for. Thank you for spending your time here to hear more about the resources. Please do spread the word to your colleagues across different sectors, different settings. If you have resources that you would like to see added or you want to contribute, please do get in touch via the ltlc@hee.nhs.uk inbox. We will be very happy to look into what we can do to update you. And also do check out the site if you haven't already, and have a look for the poster. There's a poster you can put up in whatever clinical area or whatever area you're working in that has a QR code on it and advertises the program page and has a QR code so people can go straight to the site. So please do have a look for that and put it up in your clinical areas. We look forward to seeing you again. Don't hesitate to get in touch, and thanks again for joining us.